Hi and welcome. Here we are. I'm Marla with Nine Health, and I'm here with Pereira. And I'm sure I butchered your name, so apologies in advance.
It was perfect.
That's nice of you to say. But we're doing our Health Happens because we know health is happening every day for different people, different ways, and we're all health consumers now. And so we want to talk about the things that can really affect our health. And gosh knows weight is one of them, right? So our weight, whether it's a healthy weight or a little bit over that healthy weight or under that, really makes a difference in our health. And so we wanted to talk to you today about how that is and what we can do about it. So thanks for joining us.
Yeah, you're very welcome.
And introduce yourself just a little bit and tell us what your role is at Denver Health and the like.
So I'm Dr. Pereira. I'm an endocrinologist at Denver Health and also associate professor of medicine at the University of Colorado in the Division of Endocrinology. And so I see patients with problems in endocrinology, including obesity and diabetes and other weight-related problems. And I also do a little bit of research. And I run a diabetes prevention program out in the community.
So you're busy.
I'm busy.
But all good stuff. And, we want to talk. I feel like either we're talking about our weight all the time. That's all we think about. I don't know. Maybe I speak only for myself. Or it's something we just don't even want to talk about. It's like, I don't want to know about it. I don't want to get on the scale. I'm going to avoid this, right?
Yeah, absolutely. And especially around the holidays. This is the time when we start thinking, do I have to worry about my weight? Can I not eat this?
Right. And what is it that I'm supposed to not eat and eat and like that? And so,
absolutely.
But we wanted to have a conversation today. And for me, I know that I'm always thinking I need to lose 10 pounds. And the truth is probably, most of us are overweight in America, even in Colorado, right? You're saying that 1 in 5 in Colorado were overweight.
Yeah. It's 2 out of 3 American adults have overweight or obesity.
Yeah.
So it's definitely a problem.
Yeah. And they're saying it's an epidemic with people now these days. It's everybody is really struggling with this. And I know for myself, like I said, I always think, I want to lose 10 pounds. But do I really need to lose 10 pounds?
Right.
Do I really have to? What would you say?
Yeah. So the important thing to do is think about, figuring out what your BMI, your body mass index is. Right. And so that helps guide you to know if your weight is a healthy weight or maybe not so healthy weight. So that's the first step.
And that's pretty easy. You can do it at a Nine Health Fair, by the way.
Absolutely.
Then we have them this weekend and every weekend through mid-November. But it's also, you can just do a pretty easy equation. What's that look like?
Yeah, so there are calculators online. You can just look up BMI and a lot of different calculators will pop up. You put in your height and your weight and it'll give you a BMI. And then the BMI ranges. So if your BMI is 25 to 30, that's in the overweight category. If you're 30 or above, that's in the obese category.
Okay, and when do I need to worry? Like when my BMI gets to what number, do I need to really start to worry about it?
So if your BMI is in the overweight category, it may be okay as long as you don't have risk factors for other weight-related problems.
Yeah.
So if you're...
Like diabetes, right?
Right. If you already have diabetes and you're in the overweight category, then losing weight might be a good idea. But if you're a healthy person, you're active, you eat a healthy diet, you're in the overweight category, just the recommendation is not to gain any more weight. So try to just maintain your weight.
Yeah, okay. So, and that's important because I think sometimes we put a lot of emphasis on weight and we do the thing, especially with women, like body shaming and like she should be a different shape and, the magazines all show us the skinny models and, how does that affect us? That's not good either, right?
No, that's really hard. I think we have to make more of an effort to separate the effect of weight on our health and the effect of weight on or the association with who we are, because weight has nothing to do with our personality, with the way we, with our characteristics, with anything like that. And so, we have to separate that. Think about weight for health reasons, but otherwise,
not worry about it so
much,
right? So we're getting some feedback here. Thank you guys for watching, and we need to speak louder. So we're in a different room than we're usually in, and so we're going to try and go ahead and speak a little bit louder so everyone can hear us, because it's a really important topic.
Absolutely.
And I don't think there's enough real information about it. We read, health or whatever story, and we think, oh, the next diet, that's what's going to work for me. I'm going to eat all fat for 3 months. How good is that for me?
Those diets are dangerous, definitely. Well, we think that if we can just lose those 20 pounds or 30 pounds or whatever it is with a diet, that's all we need to do. The problem is that sometimes losing the weight is not that hard, but keeping it off is the hard part. And so we lose the weight, and then we go back to what we were doing before, and then we gain it right back, and sometimes gain even more than we started out with. And so we have to be careful with those diets. We have to be very careful.
I think I might have tried them all. So I'm listening to you very carefully right now, because I'm guilty as charged, right? Yeah. So, well, what would your recommendation be then, if not those diets?
Yeah. So I recommend trying to make small changes that you're going to be able to maintain. So think about first, when you're thinking about your diet, think first about getting rid of the stuff that you don't need in your diet. So junk food, sodas, lattes.
Oh gosh, it's pumpkin latte season right now. How could you say that? But I hear you.
It's not that you shouldn't have a latte ever, or a dessert ever, or that.
Right.
There's no absolutes.
Thank you.
But
Thank you, doctor.
you just but you have to think, okay, if I'm drinking this latte, then is that more than I need when I think about what I had for breakfast, lunch, dinner, and all my other snacks? Or is that okay? Okay. And so just balancing things out.
So balance. Okay, I can work on that. And then you say little changes. What are some other small changes that you might recommend?
Yeah, so being more active. Everybody, we all have a hard time finding a time to exercise. Thinking about maybe getting exercise during the day while you're doing other things. So you're going somewhere, go up the 2 flights of steps to your, to your apartment or whatever it is, rather than taking the elevator. Park a little farther in the grocery store, so you're walking across the parking lot as opposed to finding the closest one. Get a little bit of exercise in there during the day. We save gas
that way too.
Right?
You're driving around the parking lot.
Walk to your mailbox if it's outside of your house. That kind of thing. Just thinking about doing a little bit more activity, also standing more. So research has shown that we sit a lot these days. We just spend a lot of time sitting in front of our computer or watching TV or whatever it is. And just standing every so often and walking down the hall helps our metabolism stay up.
Yeah, we have one standing desk at our office, and so we rotate it around. So, one person gets to be healthy, but when it's my turn, right, I really notice that's a change for me to stand and work on my computer, and it really is helpful. Yeah, so I appreciate that, and then other staff members have said they just get up and walk around every hour, right?
Yeah. You can go up and down a few flights of stairs, 5 minutes of just walking down the hall or up and down stairs, and then go back to sitting, and you're good.
And a lot of people are wearing the Fitbits and the Garmins and the wearable devices that really prompt you to get up.
Yes, there's all sorts of apps now that tell us we need to exercise more. Yeah. So those are useful.
Is that working?
Because absolutely, I think so. I like them actually. I compare steps with my kids actually in the evening. They're the ones that ask me, "How many steps, Mom?"
Good. So you made it a little contest in your house.
They always beat me.
Oh,
always,
really?
Always.
Even though you're really pretty active during the day, do you walk around and do rounds or in your work?
I do. Yeah. Absolutely. I'm walking between buildings, but there are days when I don't have clinic, when I'm just sitting for half a day, and so those days are tougher, and I need to really remind myself to get up and walk around. But it makes a difference. Those little 5 minutes add up.
They do. So tell us a little bit more about your work. I'm so interested. You say that some of your work really can help people lose weight if those diet and exercise tips aren't quite enough.
Yeah. So part of my work as directing the diabetes prevention program is this is a program, what we call a lifestyle program. So it helps people learn how to eat healthy foods, how to do more exercise, how to track what they're eating and track how much exercise they're doing. And so, so this program really helps people. Primarily, it's meant not for weight loss, but to prevent diabetes. So it's meant to help people make these long-term changes that maybe are not going to help them lose that much weight, but are going to help them lose enough weight to not get diabetes later in life.
That actually seems good to me. Like, you don't have to lose a ton of weight. You have to just lose a little bit, and that can help you prevent diabetes.
Absolutely. So 5 to 7% is what people say.
So if you weighed 150 pounds, I'm not good with math, but let's say if you just weighed 150 pounds and you needed just to lose 5 or to 7%, that's not a ton of weight.
Yeah.
I mean, what is that, like 5 or 10 pounds? Less than 10 pounds, right?
Yeah.
So that would be pretty manageable, I would think. Even though losing 1 pound is hard for me, but 1 pound is 1 pound.
Right, absolutely. So, and for people who have been gaining weight year after year, even if it's a little bit of weight, just staying the same and not gaining the weight is very, very helpful. Yeah. So as a first step, what I tell people, my patients, if they've been gaining weight, try not to gain weight. Try to keep it where it is. And that's gonna require some changes if you've been gaining weight every few months. So that's the first step.
And if you can prevent diabetes, that's a pretty big boost to your health, isn't it?
Absolutely. Diabetes is not something anybody wants. Diabetes is a very serious disease. It can increase your risk for other problems, heart disease, kidney problems, foot problems. And obesity can, even without diabetes. Obesity also is associated with a lot of medical problems. And so, and now we're talking not overweight, but really more severe obesity.
Yeah. So, if you can prevent those things, though, I mean, it's not like a doomsday, you're going to get this stuff. I mean, if you can maintain a healthy weight, you can kind of prevent some of that stuff.
Absolutely. Yes.
What I'm feeling like you need to do.
Yes. And even if you're still in that overweight or obese category, if you're maintaining your weight or losing some weight, that's going to help. That's going to improve your health. For sure.
Well, and here's the question I have is, how much does your age affect your weight and your weight gain?
Yeah.
Because we're all getting older whether we like it or not, I think.
We are. Unfortunately, we are. Yeah, the problem is as we age, our metabolism also goes down. So the amount of energy that our body uses goes down. And that means if we're still eating the same amount of food that we were eating when we were 30, we're going to gain weight.
We're not 30? Wait a minute. Just kidding. Okay,
in a while.
Okay.
Yeah, that's what happens. Yeah.
So my metabolism is going down, stopping or whatever, reducing. Let's say that. So what do I do? What's your tip for me? Because I want to maintain my weight. I want to avoid this diabetes. I want to avoid those kind of health things that are gonna really get me if I keep gaining weight, right?
Yep. Well, first, find out what your BMI is.
Okay.
Where that BMI, is it in the overweight or where is it?
Be honest,
Think about your risk factors. Do you have siblings, parents who have weight-related problems? That puts you at risk for weight-related problems. So diabetes, high blood pressure, high cholesterol, all of those.
Okay.
Heart disease. And then the other thing is waist circumference. So sometimes waist can help. If you're in the overweight category, but your waist circumference is higher than it should be, so that's 35 for women, 40 for men.
Okay.
I'm sorry, back the other way.
Okay.
That can mean that you're at an unhealthy weight, in the overweight.
So even if I am overweight and my waist circumference maybe isn't that high, I have fewer risk factors.
Exactly.
Okay.
Yeah.
Okay, good to know.
Yeah.
All right. Yeah.
So that's the first step.
Yeah.
Thinking about, are you eating a healthy diet? Are you avoiding the junk food as much as you can? Are you getting your fruits and vegetables? Drinking lots of water? The other thing we think about is avoiding the calories that are in liquids. So
Okay.
the body doesn't sense liquid as a food. It doesn't typically make us
Right.
feel full. And so it's sort of like sneaking calories into your body if you're getting a lot of calories from your drinks. And
That's a good
so,
point.
yeah.
Even the latte, the pumpkin latte.
Even the latte.
Yeah, I understand. And the
So
juice
thinking
and the
about-
soda, all of that too, right?
Yeah.
Okay.
And then thinking about 30 minutes of exercise at least 5 times a day. And this is moderate exercise. So we're thinking exercise that makes us sweat and makes our heart rate go up.
Okay. So 5 times a week, I want to get some exercise in,
Mhm.
30 minutes
30
at
minutes.
least. Okay.
Mhm.
Okay.
Yeah.
Well, those
That's
are.
all.
That's it.
So
So
easy.
simple, right?
No,
So
we
simple.
know it's hard. We know
Yeah.
it's definitely hard. It's hard for everybody.
But it can make a big difference in some of those health issues that you're talking about, and that's so important. And I appreciate you giving me that advice because I think we're all kind of dealing with it in our own way, whether we think we're at the right weight or we think we're overweight, or maybe is it possible to be healthy and active and be overweight?
Absolutely.
Okay.
Absolutely. If you're active and you're eating a healthy diet, you can be totally healthy, and all you need to do is not gain weight.
Okay. That could be your
Maintain
goal.
your weight.
And you could be skinny and not that healthy, or I shouldn't
True.
say skinny, thinner.
You can. Yeah, absolutely. So being too skinny is not a good thing either. So BMI less than 18.5 is typically not healthy. And so going too much the other way is not a good thing. Your body needs nutrients. It needs enough calories to function.
Okay.
So
Well, we're going to wrap up, but if you had kind of one real world piece of advice to give people to finish up here, what would you say, Dr. Rowe, from your mouth to our ears?
yeah, so I would say, don't think about so much that absolute weight. Don't worry so much about the weight, but think about, are you following healthy habits? Are you being good to your body?
Oh, that's great.
Yeah.
And that's a little bit more freeing for me.
Yeah.
I feel better about that.
Yeah.
So thank you for saying that.
You're welcome.
Yeah. Well, thank you so much for joining us. We're going to wrap up here, and please remember that we do have health fairs. You can measure your BMI along with other health risk factors at any health fair. Go to 9healthfair.org to find one near you, and we have them every weekend until mid-November. So, thanks.